Okay, so let's start talking about what is driving your symptoms. So remember, I have not met you. I have not seen you walk to my room. I have not assessed your posture. I have not heard your symptoms. I have not anything. And I'm talking in a very as broad of a way that I can and give you a little bit of tidbits along the way. So I made this handout. It is not in any particular order. The order that I think I naturally picked was what is the easiest way that I can send you home with something so that way your symptoms will decrease. So looking at someone's tummy. So whenever someone is having pelvic pain, they hurt right there. But right there is a lot of things that actually start and stop at the stomach. So I introduced a colon massage, and then it turns out that a lot of these people that suffer from pelvic pain, a lot of pelvic symptoms, recurrent UTIs, rectocele sensation, actually suffer from constipation. So colon massage, it starts on your right above your right hip bone, the one that kind of pokes out. And then you're going to go in a horseshoe pattern up over your belly button, up under your rib cage, and then down the left side, and then over underneath your belly button. So you're kind of tracing, I'm going to follow this way. You're tracing from the right side under, and then going back down, and then kind of pushing that poop down. So you want to be kind of a gently, not aggressive, forceful, but with like a fine hand. You don't want to hurt anything. The whole reason why you're here to see me is because things hurt, and I don't want anything to feel like you're hitting a thumb with a hammer. It's not going to get better if you keep doing that. So I point out where the ileocecal valve is, where the sigmoid colon is. These are just junctions in that little system, that colon system. And so if things get stuck, they can get stuck right there. And so I just spend extra attention at those curves, at those joints. So the nerves can also get stuck in the myofascia. And so as we're doing that colon massage, I can tell them, is anything tender at this space? And then we'll just stay there. And what's nice is that no matter what, you're increasing blood flow to that space. So you're not poking, you're more pressing like you would, like if you were gonna like roll pizza. It's just gonna feel really, really nice. So I also teach people, I didn't write it down, but how to plow the field. So starting, like if your belly button is right here, starting on the other side of your belly button at your rib cage, and just kind of trace those fingers down. And if you feel a tender spot, then just stay at that tender spot and breathe. And you're not poking, you're just holding, you're increasing blood flow to that space. And I tell people to try to hold it for 45 seconds. You may be decreasing, maybe releasing a trigger point at that space. You have 4 layers of abs and then myofascia all in between. And then so if this is your belly button and you just started massaging on either side of there, then you go a little bit wider and a little bit wider and a little bit wider each time, taking your time. This whole process may take 5 to 10 minutes. So that way, as you're plowing the field, you're just seeing where your trigger points are, and you would go all the way down your whole side, all the way down to your hip bones, and even all the way past pubic hair to your pubic bones. Then you can find like, oh my goodness, I had no idea it was so tender all the way down here, or up under my rib cage. I had no idea. And sometimes I'll get on someone's side and be like, oh man, that is my pain in like at my vagina. Well, your quadratus lumborum, which is your side bend muscle, refers pain to the labia. So myofascially, that makes perfect sense to me. So you may feel like you're in a bind and in a pickle, but to me, all this makes sense. So I released someone's diaphragm. So as they breathe in, I have my fingers hooked under rib cage, the way that you can do this yourself. Oh, up under rib cage. And then as you breathe out, you're just and just falling all along that space. I do that for several breaths, and it is uncomfortable and make it sound like, oh, no big deal. No, like you're pressing on stuff that isn't moving. It is going to be a little bit uncomfortable. So then, and also I find that I work on some people's scar tissue. So an appendectomy from decades ago may still feel like it's kind of stuck, or a C-section scar, or even where they go in through the belly button. Um, is huge because the belly button has a fascia called the urachus, and it goes directly over from the belly button, directly tints over the bladder. And then if the bladder starts to fill, but the urachus is tight from a belly button, I don't know, for a gallbladder removal from decades ago, then I'm going to spend some time at your belly button, and you can spend time at your belly button, which is really nice. So addressing any type of scar tissue. Scar tissue is rude, and it just like binds down to everything. And it's kind of like a cement truck that's, it's dumping everything, but there's always that man with the rake, and he's smoothing it out. So I want you to not be afraid of addressing the scar tissue, that it's not just because I care what your tummy looks like. It's that tissue is invasive, and it is latching on to anything it can. Then we talk about diet and stomach acid and bloating, which is a whole other thing. And I don't go over that unless that is a symptom that you're having. And if you are, then I have a whole lecture on bloating. So looking into that, I hope that helps you see that even though you're having pelvic floor issues, I see urinary tract infections, pudendal neuralgia, that by spending time at your abdomen, it can alleviate some pain at your pelvis. So remember, you are fearfully and wonderfully made.